It's time for Parties Extra, brought to you by Party Galaxy. I am Helen Ford Wallace, and with us today are Cher Golding, Executive Director of Oklahoma AIDS Care Fund, and Andy Moore, AIDS Care Fund Board Member, and Clinic Administrator at the OU Infectious Disease Clinic. Welcome you all.
Thank you. Thank you for having us.
Well, your event's coming up July 25th, and it's called Positive Heroes. Is that right, Cher?
Absolutely. We really wanted to talk about folks that have overcome stigma, particularly in the HIV and AIDS arena. And our first inaugural speaker is Jeannie White-Ginder. She is the mother of Ryan White, who back in the mid-'80s contracted HIV through a blood transfusion. He was a hemophiliac, and they were just thrust into this world in the middle of the AIDS epidemic and became unlikely advocates in trying to really reduce stigma, allow him to go back to school.
He was actually a child.
Yeah, he was 13 at the time and was banned from going to school because people didn't understand the disease. They didn't know if a student drank after him at the water fountain or something like that, that they would have caught it. And so he wasn't able to go to school, and he just wanted to be a normal kid. And so her whole family has really been thrust into the spotlight, but they experienced a lot of shame and stigma, and she's going to give a presentation on how they've been able to come out of that and start a dialogue on how just we can change things moving forward.
And that was what year?
He passed away in 1990 at the age of 18, and so he lived about 5 years with the disease, and so it was about 85 that he contracted the disease. But I remember growing up watching that on TV and seeing this little boy that wasn't able to go to school and couldn't have a normal life, and the bullying that happened for them, and things that they had at their home and their neighborhood. Their neighbors were not kind to them as well, and so it was just a whole lot of challenges that they struggled through just to try and be normal.
And then his parents became activists, which is, that's wonderful to take up that cause.
Absolutely, and I mean his legacy lives on.
And there's a federal program in there.
Absolutely. Andy can talk more about the federal program that his clinic receives, part of that funding.
Yeah, the Ryan White HIV and AIDS program is the largest domestic funding source for HIV care. Jeannie and Ryan had no idea at the time that it would grow to be what it is today. Altogether, it's a $2 billion a year federal program. Oklahoma receives about $10 million a year out of that.
That's major.
Yeah, it has changed the shape, changed the direction of the HIV epidemic, so that people that are enrolled in care that come to a Ryan White funded program like the one at OU have much better health outcomes. And so today, if someone's infected, it's still a serious disease, but their life expectancy isn't any different than it would have been had they not been infected, provided they take their medication and live a healthy life.
And this is the first event like this. Is
Absolutely.
That the inaugural?
It's our inaugural event, and we just thought what better speaker than Jeannie to tell her and Ryan's story and really kick us off in trying to start that dialogue and reducing stigma and trying to normalize the disease. It's still not very talked about here in Oklahoma. I mean, we do our large-scale event, Red Tie Night, every spring, but the rest of the 365 days out of the year, we're not talking about it in a regular fashion and putting it in the forefront. And this is just another way for us to remind folks what's happening here in Oklahoma and how they can help.
And it's at Skirvin, and it's evening. I mean, first of all, you're having a reception and a welcoming or whatever, and then it's just a evening to listen to what she has to say.
Yeah, there's a meet and greet opportunity from 5:30 to 6:30 for folks that have registered online for their meet and greet opportunity, and we'll have cocktail hour and heavy hors d'oeuvres through that time as well. And then we're going to present starting at 7. Our program will start, and we'll present also our Richard May Award, and then Jeannie will give a speech, and there'll be time for question and answers as well. So we have a lot of folks in the audience that have grown up and work. Their career is in HIV prevention and treatment, and so it's a great opportunity for them to get to talk one-on-one with her as well.
And Richard May was a founding board member.
Absolutely. He was one of our founding board members. As you know, Oklahoma AIDS Care Fund was formed with Barbara and Jackie Cooper, were our founding board members, and so Richard May was one that joined them back in 1991, and he was just that amazing volunteer that worked tirelessly behind the scenes and sometimes you never even knew things were happening, and then they did, and you could always guarantee it was Richard that did those things. And so 10 years ago, we started an award in his honor after he passed away. And it's just been great to recognize people in this industry that go above and beyond and never really ask for that recognition. And the person that we're giving that award to this year actually works with Andy.
Oh, good.
And is very, very deserving of this award.
And so tell us about Dennis.
Sure. So, so the award winner is Dennis Creedon, who has been a great friend and colleague of mine for the past 8 years. He's been with our program for a lot longer than that, and Dennis has a unique perspective on the HIV epidemic that most of us aren't afforded. He's been coming to our clinic for 20 years and has guided countless individuals through the process of navigating care. He has volunteered his time, he's given people rides, he runs support groups, and really does all this in such a selfless manner.
Very deserving.
And so I'm thrilled to be able to be up there and hand him the award and introduce him. I know that he's excited. I think he was caught off guard when we told him, because he's that kind of guy that never expects to be the one to win something, and he is certainly deserving.
That's awesome. Well, Andy, are there statistics on this disease? I mean, do you have any?
Sure. So today,
current?
there's about 6,000 individuals in Oklahoma living with HIV, which doesn't sound like a large number, but I mean, these people have been living with HIV for decades now. You know, in the beginning, we expected them to live 6 months, maybe a couple of years, and now they're living 10, 20, 30 years with it. It's a very different ballgame. They do have a lot of needs. Many of them are struggle with homelessness or drug addiction, and they have kind of complicated lives because of HIV and for some other factors. And so what we do at our program and with the AIDS Care Fund is really try to provide wraparound care so that we can reach out to folks and help ensure that they have access to health care, to housing, to treatment, to food, and whatever other resources they need so they can live long, happy, and fulfilling lives.
Well, that's pretty awesome. You all have volunteers that help you, or staff, or offices? What?
Yeah, we're really small at the Oklahoma AIDS Care Fund. We're a staff of 3, so we take on a lot and wear many hats, but we're always looking for new volunteers. Red Tie Night being the largest event we do, we have about 100 volunteers that come through and help start to finish to make that event successful. But we're looking to expand ways that folks can volunteer more frequently with us. We do have some issues around HIPAA and that we want to protect everyone's privacies when we go into organizations that are providing the direct services to clients, so that we respect their privacy. But we're coming up with new ways to get involved in the community and participate in pride activities and some of those other things that do education and outreach, so we can work on the prevention side, not just the treatment side of HIV.
And you mentioned Red Tie Night. That's a major fundraiser for you all. And so tell us a little bit about that and who your co-chairmen are for this year and when it will be. And then also, used to all the florists would get together and decorate, and it was the most beautiful. The flowers were always lovely. So tell us a little bit about it.
Yeah, so Red Tie Night, we're coming up on our 26th year for Red Tie Night.
26 years.
Yeah. And so that will be on it'll be on Saturday, March 3rd, 2018, at the National Cowboy and Western Heritage Museum. And this year our chairs are Scott Davis and David Leader, and we're working on hopefully a local celebrity honorary chair that we can announce here pretty soon, but we've got some things working behind the scenes. But you know, we have a large and very ambitious goal, but 100% of the net proceeds from this event go back out into the community, and they are used for our grants program. And so we just wrapped up our grants opportunity just last month, and we were able to put $186,000 back into the community for prevention and treatment and services. So the money stays in Oklahoma. We're in 54 of the 77 counties here in Oklahoma, so we're very statewide, have a large reach, and it just is so critical to have those dollars to do so much, because we're one of the only funding opportunities outside of federal dollars for these programs.
And the flowers.
Oh gosh, the flowers are just absolutely beautiful. For several years, we've had many of the different florists have come together and help with the different arrangements. Last year, we worked directly with New Leaf florists, and they were able to then work with all the other florists in town and the wholesalers and get a large portion of our flowers donated. So they cut our costs and make sure that the money that we're raising really truly goes back to the need and not for these elaborate decorations, but they are elaborate and luxurious. And it just was the most beautiful room. It always is every year.
Every year's been that way.
And we always try to change it each year, make it a new surprise. So even though we may be at the same venue, we try to really enhance things and make it seem like you're in a whole nother world in a new place that you haven't been before.
It's always a sellout crowd.
Absolutely.
Well, I hope your talk, your intimate evening is a sellout crowd too. So does it cost to go?
It is. It's $65 for the general admission and then $150 for VIP to have that one-on-one. And we really have it, it's a small number that we've limited those tickets to, so you really do get to have some very personal time with Jeannie White-Ginder and really get to talk to her and have that opportunity. So we have tickets on our website.
What is the website?
We have two websites. You can either go through our website, which is okaidscarefund.com, or the Positive Heroes OK.com to get those tickets. We're also selling tickets at the door, so if you don't have your ticket, you won't be turned away. We'll be welcoming you at the door, and the price is the same.
Great. So any other projects you all have besides your red tie and this one? And
I think the other thing
Positive Heroes?
I think the other thing that we're working on that's big, that's going to be a community-wide effort, is World AIDS Day. That happens every year on December 1st. It kind of is right around for nonprofits time during Giving Tuesday, right after Black Friday and Cyber Monday comes Giving Tuesday and then World AIDS Day. So we're right in line, and so our goal is to paint the town red. We're working with the folks at Downtown Inc. to help us do that and have a lot of give back opportunities. We'll have an art show to start some conversations and have artists that are presenting work that's either in the theme of the color red or HIV and AIDS care. So we hope that you'll start to see a lot of red ribbons popping up here pretty soon.
That's awesome. How about you, Andy?
Yeah, I was going to echo what Cher said, that World AIDS Day last year became an opportunity for us to raise awareness about HIV in a way that hadn't been done in many, many years. And so I'm thrilled that the AIDS Care Fund has been able to help us take the lead on painting the town red and getting awareness out into the community in groups and kind of social circles that may have forgotten or not grown up with it in a way, so that people don't forget that that HIV is still very real and still a part of our community. There's a lot that we can be done.
And we're just happy. I mean, people are living longer. That's the best
We're
part.
very excited. I mean, in the beginning, we had some research that we looked at just the other day about the original caseloads, and in that first year that the Department of Human Services had clients, all but 10 passed away within 3 months of getting those clients in. So there was a lot of loss early on, and we're very proud with all the efforts that are going on and the advancements in treatment and care, that at least we're able to give folks a really long quality of life now and be able to help them just live a good, happy life. And it's more like a chronic disease, very manageable now, similar to diabetes. But, we still want to have that message of prevention out there. And so, we're always working hard on that message too.
Good job, you all. Good job. Well, thanks, Cher and Andy, for telling us about Positive Heroes and your wonderful evening coming up. We hope it's a great, great success. Thank you.
Thank
Thanks,
you.
Ellen.